How do medications affect PSA test results? Imagine trying to read a map that has been smudged or altered. That's similar to what happens when medications influence PSA test results. The prostate-specific antigen test measures a protein in the blood produced by the prostate gland. It helps doctors screen for prostate issues, including cancer. But certain medications can change PSA levels, making interpretation tricky. Some drugs can cause PSA levels to go up, which might suggest a problem when there isn't one. For example, testosterone replacement therapy increases androgen levels, which can stimulate PSA production. Steroid-based anti-inflammatory drugs like betamethasone can also raise PSA levels. These increases might lead to unnecessary worry or further testing. Conversely, other medications can lower PSA levels, potentially hiding signs of prostate problems. Non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, and naproxen reduce inflammation and can decrease PSA levels. Cholesterol-lowering drugs called statins, like atorvastatin and simvastatin, have been linked to modest reductions in PSA. Blood pressure medications called thiazide diuretics and drugs used for benign prostatic hyperplasia or male pattern baldness, like finasteride and dutasteride, also lower PSA levels. The effects can be significant. Long-term use of NSAIDs, statins, or diuretics can reduce PSA levels by anywhere from about 6% to over 25%, depending on the drug and how long it's used. Sometimes, combining these medications can amplify the lowering effect. This is important because if PSA levels are artificially lowered, it might delay diagnosis of prostate cancer or other issues. On the other hand, if medications raise PSA levels, it could lead to unnecessary biopsies or anxiety. That's why healthcare providers always review a patient's medication history before interpreting PSA results. Patients should tell their doctors about all medicines they're taking before getting tested. In summary, medications can influence PSA levels by affecting prostate cell activity or inflammation. This can make PSA testing less reliable if the effects aren't considered. Understanding how drugs impact PSA helps ensure accurate diagnosis and appropriate treatment decisions. Always consult your healthcare professional for personalized advice, especially if you're on medications that could affect your PSA levels.